Hi everyone, thank you so much for joining us today. My name is Jessica Stewart. I'm the Executive Director of the Family and Community Services Insights Analysis and Research Directorate, also known as FACSIAR, within the Department of Communities and Justice here in New South Wales. And welcome to this month's Lunch and Learn Research Seminar on supporting families with complex needs with child protection contact, findings from a new ANROWS study. Before we begin, I would like to acknowledge that wherever we're joining today's webinar from across New South Wales, we're living and working on Aboriginal land that was never ceded. I'd like to personally acknowledge the Bidjigal and Gadigal people, who are the owners and First Nations people of the area where I have the privilege to dial in from today. I'd like to pay my respects to all First Nations elders, past and present, and extend that respect to Aboriginal and Torres Strait Islander colleagues who are joining us today. I'd also like to warmly welcome all of our webinar participants. We have had more than 1,000 people register for today, which is really fantastic and shows the importance of this topic, particularly currently with a lot of demonstrations over the weekend. In this FACSIAR Lunch and Learn webinar, Dr. Betty Luu will present findings from the new ANROWS study. So ANROWS is Australia's National Research Organisation for Women's Safety. The study was conducted at the Research Centre for Children and Families through the University of Sydney, and it's one of the first externally led research projects to use the New South Wales Human Services Dataset. So this is a linked data set of New South Wales government data that makes it possible to see how families interact with a range of services, including police, child protection and health, and follow families over time, all de-identified data. So after the presentation, we'll have a panel discussion. I'm really grateful to our great lineup today of panel members, including Philippa Hetherington, who is the Director of Women, Family and Community Safety, Brianna Yogart, Director of Family Preservation and Child Protection, Caitlin Stewart, Director of Practice and Permanency in the Office of the Senior Practitioner, as well as Jackie Ruck, the Asia Pacific Regional Manager for the Safe and Together Institute. So I'm really looking forward to today. It will be a very interesting discussion. After Betty Luu's presentation and the panel, we'll have time for a short Q&A session if time permits. So please use the chat function, put in any questions, and our speakers can either answer those in the chat box during the presentation, or I'll come to the questions at the end. So thank you again. At this time, I'd like to introduce our presenter for this afternoon. So Dr. Betty Luu has a PhD in developmental psychology and skills in mixed methods approaches. Betty has a strong interest in understanding how the early environment can best support children's development. Her research program involves the analysis of child welfare administrative data to provide insights and drive change in practice and policy, ensuring effective implementation of practices to support children and families, and amplifying the voices of children, young people and families. Thank you so much, Betty. I also just like to let you know that this session is being recorded and will be posted on our FACSIAR webpage. So anyone that is registered for the webinar will receive a link to this recording within a week. So thank you, and please go ahead, Betty. We can't hear you, Betty, I don't think.
Obviously, it would help if I unmute myself. So thank you. Let me try that again. Thank you to Jess for that introduction, and thanks to the team at FACSIAR for inviting me for this month's Lunch and Learn. I'm super excited to be presenting the findings from this report. So first, I'd like to just do a shout out to the co-authors, my colleagues, most of them from Sydney University, who contributed to this report, and that's noting the funders of this report, ANROWS. Thank you so much. So I hope that this research, that you're as excited as I am about these findings. I think this research would be of interest to people across all different levels and roles, whether you're a policymaker, because I know New South Wales government is committed to ensuring integrated services to support children and families. For managers and decision makers and system designers, there would be interest in understanding where the gaps and the silos are that need to be addressed in order to respond well to support children and families. At the practitioner level, you know, in your own practice, what should practitioners be looking for when working with children and families affected by these issues? And for researchers like myself, hopefully of interest, the potential use of linked administrative data to inform policy and practice. So really, you know, wouldn't it be great to know and understand whether the system is joined up and working well? Before I begin, I'd also like to acknowledge the Barramadigal people, the traditional custodians of the land on which I'm joining from today, and I pay my respects to their elders past and present. And I also extend that respect to Aboriginal and Torres Strait Islander peers and colleagues who are joining this call today. So as a bit of background to the motivations behind this study, we know that from overseas research, particularly from the UK and US, looking at the prevalence and co-occurrence of these three risk factors, violence, which I'll refer to as DFE, mental health, MH issues, and alcohol and other drug use in families involved with child protection systems occurs. And in the UK, within policy, this is often referred to as, you know, the toxic trio, which, you know, some of us can raise our eyebrows at the terminology used there. And drawing from the US, the adverse childhood experiences ACEs literature also talks about the impact of multiple ACEs and risk factors and their impacts on children and adults' development and well-being over their lifespan. So, you know, moving away from overseas, and if we're looking at the Australian context, we can see there is a gap in knowledge of the role these factors play in families involved with child protection. But we do note that there is some existing research which is highlighting the existence of these co-occurring risk factors and the ways in which the Child Protection Service response is responding to the incidence of domestic and family violence and co-occurring risk factors. So this project, my colleagues led phase one of this project, which involves a critical interpretive synthesis review, and this can be reviewed, this can be read online via the ANROWS website, and it's also linked in the webinar page, which has all the recordings and handouts for this presentation here. So this was a review really looking at the academic and grey literature on the intersections of domestic and family violence, alcohol and other drug use and mental health issues in the context of child protection. And helped drive some of the thinking in terms of the analysis and the implications and things we could draw from when using the New South Wales Human Services Dataset. So some of those key findings relate to the lack of specificity and consistency in terminology, some of the lack of theory and concepts to frame the mechanisms by which domestic and family violence, alcohol and other drug use and mental health issues interact. There tends to be a focus on factors which are just more focused on the child and family, but not enough focus on other factors that might be external or environmental that impact outcomes. And as I've just mentioned, within the Australian context, limited robust empirical research looking at these co-occurring risk factors. So that's where this analysis comes in, this report, which utilised linked administrative data to look at these co-occurring risk factors in the New South Wales context in particular. So this is the full report is available on the ANROWS website and will also be linked in the post-webinar page if you are interested in reading the full report. So before I begin, some of you might be wondering what is linked administrative data or why it's important. So linked administrative data is data that's collected about individuals' interactions with different government services and departments. So, you know, that's individuals, you know, children and families who are interacting with services within child protection, justice, housing, health, education, welfare, social services, etc. And, you know, it reflects whether a person's interacted with a service or agency, and, you know, information is collected at that time. You know, it's recorded, you know, when they interacted with that services, and often information about the nature of that interaction with that service or department. Now, linking that together, you know, the data is de-identified and linked together for access for, you know, in my case, research purposes, obviously very protected by laws and measures to safeguard privacy, given the sensitivity of the data, and is only accessed by approved users. So what I'm hoping to say here is that linked administrative data has a number of strengths because it enables a population level view of looking at certain issues or events or characteristics. And it also allows you to tell a story. As a researcher, it allows you to tell a story that's not available via other methods. And one example I'm giving here is around self-reports, surveys, focus groups, linked administrative data, which records the interactions a person's having with a service, can overcome some of the self-report biases and recall biases that happen when using other methods, because people may not be able to remember well whether they used the service and when that was, and what was the outcome of all those, especially if you're looking within the whole lifespan at which they've used the service. So when linked together, linked administrative data allows a broad understanding of the pathways an individual takes when interacting with various services and agencies at a point in time and over time as well. So moving into the data, what we know or what we suspect within the sector, we know there's an intersection and co-occurrence of domestic and family violence, alcohol and other drug use, mental health issues, with involvement with child protection and out-of-home care services among children and families. So the aim of this study was to produce New South Wales level prevalence statistics to build the evidence base for children and young people involved with child protection services whose parents are impacted by these intersecting risk factors. Prevalence is really just a way to say, what proportion of the population here has a particular condition or experiences a certain event or has a characteristic at a certain point in time over a specified time period. So really, the hope with this report was to add and complement some of the existing research coming out, looking at the prevalence of these intersecting risk factors and just building a knowledge base to inform policy and practice. In the New South Wales context, but hopefully across Australia as well and internationally. So what is the New South Wales Human Services Dataset? It is a very large data asset as it involves all individuals, all children born or living in New South Wales since the 1st of January 1990 and information about their relatives. And they're included as long as they have interacted with at least one of the New South Wales services, which is probably everyone. So it's information over a 30-year period, representing a whole host of different agencies, and I've just listed them there, some of them. I don't expect you to read all of this, but I just wanted to give you a sense of the volume of information within the New South Wales Human Services Dataset. I'll just zoom in here just briefly, just drawing on the different data sets and variables which were of interest for this report. Just to let you know, it kind of sits within this whole host of data sets within the Human Services Dataset. I've got this diagram here, which I'll just slowly walk through. So what we have here on the, sorry, my animations. So what we have here, if you focus on the blue bubbles, we're talking about children's records in the child protection and out-of-home care systems. So that's one part of it. Because we know when, if you're not familiar with the child protection system, when there's a concern about children's safety or well-being, a person or a mandatory reporter can make a call to the child protection helpline and log their concerns with them. And at that point, at the helpline, the person recording the information records what those issues are, and then we're able to create these flags. There are these flags here for these different risk factors. So in this report, we were interested in flags for domestic and family violence, alcohol and other drug use, and mental health issues among the parents. And then the other aspect, so that's the lighter blue bubble at the bottom there, is whether the child's entered out-of-home care. So if it's at a point where a child has entered out-of-home care, there's also information collected as to when they entered out-of-home care, placement information, and other things like that. So now in order to do the analysis, we had to be able to link the children to the parents in the sample. So the green bubble just represents that we linked children with parents via the New South Wales Births, Deaths and Marriages Registry. And then from that point, we can then link the parents to the services that those parents interacted with prior to the child protection helpline report being made. So those are things like mental health services, whether the parent was admitted to hospital for mental health care or alcohol and other drug use issues, finalised charges being whether they appeared in court for something and charged with something involving domestic and family violence, whether a police victim report was made involving domestic and family violence, and we also had some information on use of child and family services like brighter futures. So I hope what I'm trying to demonstrate here is that we can look at people's trajectories and pathways through these different service systems and how they tell a story at different points in time, but over time as well. Because you can imagine, a child protection report being made is one thing happening at one point in time, but there's a whole host of things that might have occurred prior to that, and that's worth looking at what's happening with, in parents, how are parents interacting with services? Can that be used as information to preempt something early on before a child enters the child protection or out of home care system? Okay, so back to understand the sample that we used here. We had to, there's a lot of data. We got 30 years of data across all these different data sets. So we had to make some decisions. What was the best, which data sets are we using and which period and which points in time that we were interested to enable us to give us like a robust picture of the co-occurrence of these domestic and family violence, alcohol and other drug use and mental health issues, and subsequent child protection out of home care involvement. So we opted for looking at children who had their first ever child protection helpline report from the period of 2004 to 2018. And we were interested in the window just 12 months after their first helpline report. And we did that because we had to also account for different things like, children entering the child protection system at different ages, and other, just kind of, analytical reasons as among that, and matching all the different children and parents. So that diagram there at the bottom is, we identified 584,000 children who had our first child protection report between 2004 and 2018. And then, you can see it was a bit of an exercise in linking, children to their parents, and then parents across. We had some geographic information that we could also obtain as well. So, that was certainly took a lot of work, but we got there. And then there's, just to clarify, the mothers and other parents. So within births, deaths and marriages, parents are recorded as mothers or other parents. Other parents presumably is mostly fathers, but it would, probably could also represent, parents, the parent that did not give birth as well, but they're grouped and identified in that way in the registry. I just want to flag first here that we weren't able to analyse the data based on whether children and families were of Aboriginal and Torres Strait Islander background. I know there is an ongoing and important conversation about Indigenous data sovereignty and governance, especially when it comes to linked data, and there's importance of consulting with elders and ensuring community-led decision making. So this is acknowledged as a limitation of the report, but it's certainly an area of interest for me and I know probably for a lot of people in potential future directions as well. All right, so now that I've covered what the data set is about and the methods that was used, we can talk more about the findings. So here, I will just clarify the helpline reports were screened screened for Roche at the point of helpline, which I'll talk about in a moment as well. So focusing on what's, I've got that big diagram with the different coloured bubbles, but so for now we can just focus on what's reported in just the child protection helpline reports, and the risk factors that were flagged there, the 3 risk factors. So of the 584,365 children who had a first child protection report in that period, 2004 to 2018, 193,705 children, that's 33%, had either parental domestic and family violence or domestic and family violence alongside either alcohol and or other drug use, and alongside mental health issues, which were flagged as concerns. Right, so it's about 33%. We've got some information there around prevalence and co-occurrence. We go a bit further, we have some information about breaking it down across the number of risk factors they had. So if we just focused on that 193,000, that 33%, we can further break it down to see what's the combination of risk factors. So we could see for about 80% had domestic and family violence only flagged. 16% had domestic and family violence alongside alcohol and other drug use or mental health issues, and 2%, about 2%, with three co-occurring risk factors. And we could also look at the co-occurring issues based on other demographic characteristics like age at first report. So that's what it is on the left-hand side, that left-hand bar. So you can see that the bars reflect the mean age of the child at first report. And you can see as the number of risk factors, the more risk factors there are, the younger the child tends to be at first report. The graph on the right-hand side talks about the total number of helpline reports received during that 12-month period after first helpline report. The white representing the total number. So you can see as the number of risk factors increases, it tends to be more helpline reports. And the red indicates how many were determined to be met the threshold for ROSH at helpline. That's as there's more co-occurring risk factors, the number of ROSH reports is also higher as well. Okay. So that was child protection reports. And now this is where we kind of zoom out and we consider parents' interactions before the first helpline report. And you can see there's a number of graphs there. So just orienting you all to the graph at the bottom and the categories. So we have finalized charge, that first group of bars relates to court appearances and a charge involving domestic and family violence. The second lot of bars is domestic and family victim reports as recorded by the police. The third set of bars is whether the parent has a recorded mental health service use of that recorded mental health service prior to a child protection report being made. The fourth set of bars is whether the parent was admitted as a patient for mental health issues. And the fifth set of bars is whether the parent has been admitted for alcohol and other drug use to hospital. And we can see, I'm hoping what you can see here is that, all of these involving domestic and family violence, about 1 in 5 children had a parent who had a finalized charge in court related to domestic and family violence. The second lot of bars, so among, say, about 2 in 5 children have a police victim report, at least one of the parents having a police victim report related to an incident of domestic and family violence. And you can also see, where there's mental health issues flagged in the child protection helpline, or alcohol or another drug use flagged in child protection helpline. That's also, you can also see that parents have interacted with, a mental health service or been admitted to hospital for those issues. So I think, there's associations there. I think that makes sense for a lot of people, that this has happened in the past and it's coming up within child protection helpline reports. I think what's of interest is when there's perhaps a mismatch between what's appearing and flagged at the child protection helpline and whether a parent has or hasn't interacted with a service. Because let's say, mental health issue is flagged at the child protection helpline, but there doesn't seem to be a recorded instance where a parent's been interacting with a mental health service. So, there might in some instances of, some gaps or some, I guess something of needing further exploration. But, also you also have the flip side where if domestic and family violence has been flagged in the helpline report, but there's also some recorded interactions prior to that related to other risk factors, that's another point of which to query and think about, is the service meeting those the needs of these families who have, these complex risk factors or experiencing these complex risk factors. Remember, I mentioned there was some information around Brighter Futures, where we could look at whether parents were engaging with Brighter Futures prior to child protection helpline report being made. And we can see generally this was quite low. And I think at the time for this analysis, we were focusing on children under age 9 because of the eligibility criteria. But I know there's been work done among DCJ's child and family teams looking to redesign and reconsider and redefine the eligibility criteria and ensuring families are getting the services that they need. And we could also look at the co-occurrence of these risk factors based on location and region. So, regionality being metropolitan areas, inner regional, outer regional, and remote and very remote areas. And we can see it's the percentage breakdown is quite similar across those different region types. And, there's more information about that in the report. And, the question around how does the co-occurring risk factors associate with children's entry into out-of-home care? Overall, of the total sample, about 5% of children entered out-of-home care at least once, and 2% entered out-of-home care for the first time in the 12 months after their first helpline report. And you can, probably see having more risk factors. There's an increasing association there. The odds of children being removed within the first 12 months after first helpline report doubled when all three risk factors are present, based on our analysis using binomial logistic regression. All right, so moving into some policy and practice implications here. I'm hoping here that the findings highlight some interesting things, including the need to invest in early intervention to proactively support parents experiencing these challenges rather than waiting till issues have escalated. Another implication we can draw, well, our team drew from this is the need for effective and improved approaches, which means integrating services to address complex needs of individuals, understanding how these co-occurring risk factors intersect and tailoring interventions accordingly across service providers. And the findings offer insights into how parents' interactions with services relate to alcohol and other drug use and mental issues, which could facilitate early identification of children at risk and provides pathways to support families as well. So I hope I can provide you with some conclusions and take-home messages. Using administrative data to understand the prevalence and intersection of these issues is a way that we've contributed to conversations around whole of system design, because I know that there is a New South Wales intention to reduce siloing of services, and this study simply adds more to the evidence that's needed to emphasize how important it is to reduce siloing. I wonder whether people are surprised, but maybe this is a way of using statistics and data, this big data set to quantify and give actual rates of the co-occurrence of these factors. So the study highlights the value of a more integrated approach to assess the experiences and impacts to ensure an integrated and holistic service response. And as always, as researchers, we would say more research is needed. For example, the capacity of frontline workers to meet those needs. And I just want to add, I think there's another aspect to this, which I haven't listed there, but it's also around the integration of services, because there's integration of services for children, within children's services, and then integration among parent services. Definitely, I think what this study is adding is this notion of ensuring its integration across the child and parent level. Understanding if there's an adult and they're a parent, that there's some questions that that can be raised about whether the children are also are at risk at that point, or what can be done to better support these children and families. So yeah. Many acknowledgements and thanks to you all for listening, and for the various people who've contributed to this report. Thank you. And I will now hand over to Jess.
Thank you so much, Betty. I just quickly, before we move to the panel, there was a question from Anne McKinnon-Baker saying, does DFE cover abuse from the parent to the child as well as abuse from one parent to the other parent?
I think for the purposes of this one, we focus more on domestic, the violence between parents. I know there's different flags within the helpline report, but for the purposes of this report, we focus more on the parental factors and the risk factors at that point. Thanks for that question.
So DFE between the parents,
yeah,
not parent to child. And yep. Does it cover abuse by children and young people on parents and other siblings?
I don't think I used, I'm trying to think through. No, we focus mostly on the parents, because I know there are flags there within helpline. Yeah.
Okay, great. Yep. Thank you.
Thank you.
Thanks so much. So now we will move to our live panel discussion. So I'd like to introduce our panel members. So Philippa Hetherington has worked in senior public policy roles for over 12 years and is currently the Director of Women, Family and Community Safety. Her current role is overseeing the domestic and family violence programs and court diversion programs in DCJ, Previously, Philippa has led the development and implementation of successful cross-sector reforms, including expanding access to justice for victims of child sexual abuse and a major multi-agency reform to the management of serious criminal cases in New South Wales courts. Welcome, Philippa. Brianna Yoga joined DCJ in 2021 as the Director of Family Preservation and Child Protection. Prior to that, Brianna was a senior executive in the UK Ministry of Justice, where she worked on UK-wide reforms on renationalising probation services, addressing corruption in prisons, improving the criminal courts and justice systems. Particularly relevant to this conversation and her role in child protection in DCJ was her time leading the then PM Theresa May's cross-government reforms on domestic abuse and violence against women and girls. Welcome, Brianna. Caitlin Stewart is the Director of Practice and Permanency within the Office of the Senior Practitioner. Caitlin has a degree majoring in psychology and over 20 years experience working in child protection and out-of-home care in New South Wales and the UK. Caitlin has a particular interest in assessment work and has held roles in residential and home-based assessment programs and joined DCJ in 1994. Welcome, Caitlin. And Jackie Ruck is the Asia Pacific Regional Manager at the Safe and Together Institute. Jackie has been working within the community sector for over 20 years in the field of child protection and domestic violence as a frontline practitioner in both advocating and crisis support of families. Jackie has the lived experience, knowledge and understanding of the issue of DFV in the context of Aboriginal and Torres Strait Islander families, and has also worked in Aboriginal and Torres Strait Islander organisations as a DV specialist and as a consultant. Jackie has assisted in bringing both Safe and Together and the Child Protection Child Placement Principles framework together to enhance the lives of Aboriginal and Torres Strait Islander families in Australia. We're really grateful for having you here today. Thank you, Jackie. So welcome. I might start with you, Philippa. So just what are your reflections around the findings of the research and what do you see as some of the policy implications for domestic and family violence programs?
Thanks, Jess, and thanks, Betty. It's a really great report. So I read this with real interest. Obviously, there's the intersection between child protection and DFE and a range of other risk factors for people is incredibly pertinent to the work we're all doing across programs which are set up for the specific issue rather than across. So getting to look at this kind of research, I think, is really vital for us. It provides really, generally, I think this kind of work in linking administrative data sets, which allows us to see a much better picture around whole families, look across service systems, is incredibly helpful for us in trying to see something which is close to the family's experience, being able to see cohorts more specifically, seeing correlations between risk factors, and also I think starting to help us generate some theories really around how interventions in one service system might start to affect the outcomes in other service systems, or the outcomes which are sought in other service systems. The fact that it's empirical is incredibly helpful as well. You know, the report's, I think, very helpful in the sense that it's quite clear about what the limitations of this kind of data and research are as well. But it does allow us to see, even if the data is imperfect, it does allow us to see trends over time, which is incredibly helpful also. And also, even though I know for us in particular in DFE, in one of our programs at the moment, we're looking very carefully at risk assessment, which I know is also happening in child protection. And even though there's some concerns around the use of actuarial risk assessment models, I think there is a place for those, or at least in some circumstances, and this sort of data is incredibly helpful because it's based on our clients, our specific circumstances, and even if there are limitations again in that data that we're using, we've got leverage to change the way that we collect the data, and we also can see those trends over time. So I found this report incredibly helpful. I guess the basic point about a report like this is it gives us better insight in terms of what to look at. It doesn't necessarily tell us what to do, but that in itself is incredibly helpful. In terms of what the policy implications might be for domestic and family violence programs, there's kind of a couple of ways you can think about this. You can go really broad and think about, what should we be doing? What are we not doing? What are we missing? But I thought for today I'd actually concentrate more on what are we specifically trying to do with the specific DFE programs and service systems that we have, and what do the insights in this report give us that help us improve the programs we're already running. So with that in mind, I'll very quickly just say something about the programs we are running in terms of specific DV programs. Basically, there's two areas, I suppose, that where I think the report's very helpful. One is that we provide specialist DFE case management programs addressing the response to victim survivors who are at that point of being at risk of further domestic violence. It's often called crisis management. I think it's broader than that. But it tends to focus on safety planning to manage the immediate threat, and also case management around reducing future risk of DFE, reducing the broader impacts of DFE on adults and children, including, I guess, a major one is staying home living violence, which has a specific focus around promoting or supporting protective factors like housing and referral pathways. So there's a lot of focus on referring out. What it doesn't give us is that we don't really have a theory of change about how that specialist DFE response affects the broader issues affecting our clients. So we don't have a theory of change about how supporting people through these programs affects child protection outcomes or outcomes in relation to alcohol and other drug use or mental health issues. So that's the one major part. The other thing we have oversight of is Safer Pathway, which for those who don't know is essentially our interagency architecture for managing a broader response to someone who is at risk of DV and currently experiencing DV. So Safer Pathway also refers people into specialist case management programs, and most people go down that route. But it also provides access to what's called a safety action meeting, which is a fortnightly meeting between all the major human services agencies around housing, child protection, health, mental health, police, corrective services, and a range of NGOs, the purpose of which is to review how they are having contact or whether they have contact with the person who's been referred, the victim who's at risk, or members of their family. So it is our current, what we have currently to try and better coordinate our response to people who are at risk right now across all the different parts of government and all the different services and service providers. One thing about that system right now, though, is 98% of our referrals come through following a police attendance at a DV incident. So it means that it's really only addressing one type of client. So to getting back to the research that we're looking at today, the thing that's, I think, most helpful for us about this is that we're very focused on trying to understand what can we do to broaden our referral pathway into this architecture for a coordinated interagency response. You know, we know that lots of people don't report to police. What we can't see is if they're getting how to find people who are either, well, who are at serious threat and who are not getting a service response elsewhere. It's actually quite difficult to work out how to bring those people in because there are other service responses as well. So we don't necessarily want to duplicate. We're looking to find how can we identify a group of people who are at serious threat of DV, who are not reporting to police and who are not getting a service response elsewhere. So just one of the stats in this report, I think was actually incredibly helpful, actually two. So two together I thought was really helpful. One is that just looking at the cohort that the study looks at, which of course is child protection reports, to the helpline, 33% of those kids are found at that point of coming into that reporting system to be experiencing parental DV. And then added to that, when you look back at the records of those parents, only 40% of those parents have a previous police report of DFE. So there's actually quite a substantial number of people there who are coming through who are not getting referred into Safer Pathway, definitely, and potentially are not being referred into other services either, with quite low levels of service interactions, which I know in some respects in the report presents as a problem. But the fact that there are low levels of service interactions also with mental health and AOD services suggests to me that actually child protection helpline potentially is actually a really important lever that we might like to try and explore in terms of bringing people into Safer Pathway. So there's that. I mean, looking at the other side, of course, I'm looking at it from a DFE specialist service response. From the child protection response, we have had preliminary discussions in the past, and the child protection system, of course, has its own concerns. It has its own outcomes that it's striving for, and it has its own issues in terms of being overstretched. So are there advantages from the child protection system in terms of a greater interaction or for more referrals through to DFE specialist services? And I mean, it's only an inkling. I don't think this is conclusive in any sense, but there's some inklings in the report that perhaps there might be some advantages from the child protection lens as well, in that the low levels of engagement with the sort of non-ROSH response, so family preservation, better beginnings, brighter beginnings, sorry, that there might be some ways in which the DFE specialist service sector might provide some alternative referrals that may support some of the child protection outcomes. It's a big claim, but it's worth investigating. I'm not sure how much time I've got left. I had lots of ideas about this report. It was like full of rich insight. I might just like not go too far into too many details, but I did think there was a range of other things that were really worth looking at. We're interested in geographic hotspots as well. We've been doing our own mapping around that. I think this is another kind of data set that we'll like to have a look at in terms of how it fits with what we've looked at already. Referrals out is something which is a huge issue for us. We need to be able to see it better. We need to understand what we're doing better with that. And I think there's a piece of work that noting what I said before about the low uptake of some of the other programs for which are non-ROSH responses, I think there's probably some value in understanding how referrals out from our services, given the cohort that's identified by this study, having a better oversight or insight into what's happening there and whether there's interaction there. Also, there's some really interesting comments about data that we collect. I think we should go back and have a look at our referrals in and our referrals out data, geographic data. And also notice that the issue around family structure is something that we could possibly supplement as well. So a whole range of things I'd like to look at, but definitely a really, really good insight, I think, around where the level of, the size of the cohort that might not be getting a DFE response that we could potentially look at. Thanks.
Thanks, Philippa. They're really insightful reflections. Thank you. So I might turn to Brianna now. And in your role, Brianna, particularly in those sort of family preservation, family support programs, and you saw the findings around the sort of limited uptake of those for families that Betty looked at. What are your reflections on the research and the implications for policy?
Yeah, very, very similar to Philippa. I think this research has been really good to get that quant understanding of the kind of scale and a really kind of robust basis. And I think it gives us a real framing to going into and understanding some of the nuances between these different risk factors and how they play out for families and for children and for women in particular, because obviously this is a DFE being quite a gendered issue. I think it'd be interesting to use this as a basis to do some quant stuff and some really kind of user experience led kind of exploration of how mental health and drug and alcohol abuse and DV all interact to cope with trauma or intergenerational trauma and things like that, and really understand actually which of these issues are actually presenting risk and which are actually not presenting risk. They just happen to coexist with other risk factors or not at all. And really importantly to that is that DFE, even when it is in the interpersonal lens between kind of two adults, does victimise a child, and the Australian Child Maltreatment Training kind of shows that. So I think it's a really helpful hook to go in and understand that nuance between the kind of toxic trio for the disbenefits of using that language, and really understand what's going on here and not be too blunt about it. And yeah, kind of bring that through. What it all kind of presents to me from a policy and program point of view is making sure that what we're doing is anchored in the experience of people and clients and families, and that our responses are trying to do exactly as the researchers, Betty and yourself, kind of identified. It's not system integration, recognising, you can't actually, can we be really clear on who our clients are, what risk is, what risk is it to whom? Is it to mum? Is it to kid? Is it to family unit? That understand those pathways into services and have a supply of services that is healthy and ready to respond to that. And in those service systems, being really clear about which of those needs specialists and specialist help, and which of those are more generalist, even if where that generalist is got very high skills at dealing with mental health, drug and alcohol, and DFE. So I think that's kind of my take into it. In terms of family prayers, we've tried really hard in our redesign, and I'll plug our discussion papers out there. You'll get a link. It's all very exciting, to really rethink and take a client-centered approach to our design here, and recognise that clients who are experiencing mental health, DFE and drug and alcohol challenges are core business. These are not the kind of high risk factor clients. This is core business, and our family prayers services need to be able to respond to that in a holistic and integrated way. And so we're making sure we're opening up that eligibility, kind of as you alluded to, Betty. We're proposing to make sure we have community referrals that can come in from these different pathways. And we're proposing that the models that we commission space to service providers to innovate and develop their own models and leverage the strengths that they have and capabilities in their organisation across these different specialisms, but also linking in with the wider service system where they may not have that built into their organisation, and partner with other agencies and DFE services and health services and things like that. And I think underpinning all of that is a real drive and push. And, Caitlin, I think you might be up next around building awareness and capability in the workforce that sits in these different service systems, whether that's in DCJ or family preservation or DFE, in a consistent understanding of risk factors and how to respond and where and how to integrate. And I think giving that capability and that agency to individuals in a system is what can allow us to give a more effective response to clients. We'll stop. I won't keep talking because I also get very stimulated by the research.
Thanks so much, Brianna. And you can put the link to your discussion paper in the chat if you like. So over to you now, Caitlin, and we'll change tack a little bit. What are your reflections on the research and implications for practice?
Yeah, thanks, Jess. Betty, fantastic research and really valuable for our work. Working with families day in, day out on some of the challenges. And I guess from a practice lens, wanting to draw out the importance of seeing risk on paper compared to what the impacts of children on their day-to-day lives and their experiences. And for us and our workforce to really understand that risk can look one way on paper, and in a family's home, in a child's life, it can look very different. And one of the things we really need to be mindful of is what impact are each of those challenges or factors having on the child, having on the parents, and what are the protective factors in that family that might be guarding against some of the risk that we would be, again, very attuned to when the reports are coming in and we've got those intersections. I think it draws out so many elements of us to be mindful of in practice. I think the way we engage fathers or the lack of engaging fathers, how we consider women's access to services for mental health and drug and alcohol when they are experiencing violence and they're experiencing coercive control in the relationship, and how able they are to access services. We must have from a service system, but also from DCJ. I think it's a great opportunity to remind us all that we have to hear children's voices and understand how they're experiencing their parents, how they're experiencing their parents' drug use or mental health issues, how they're experiencing the violence being used against one parent or another, and us as a workforce being really mindful that these factors coexist in families. These challenges are real. They are steeped in intergenerational trauma, socioeconomic disadvantage, but also in many, many other households. And we really need to be thinking that whilst there might be a presenting issue, we have to be attuned to these factors probably being more prevalent in families than we might first think when we enter a home, and being, you know, I know this word's overused, but really curious about what is going on and what is triggering some of the risk, and how we bring in the wider network. I know we've talked a lot today about the professional service system, and there's such a need for that. I would absolutely welcome discussion around services not being siloed. Can you imagine how overwhelming all these different services when these are coexisting challenges? But I think we have to also understand the and networks play for children to safeguard and protect them, and also support families and parents who are facing these challenges. And that's a role that I think DCJ can absolutely play from the beginning, particularly when you look at your research, Betty, around the entry into care rates and what it's like in that first 12 months of us receiving reports. That's the time we've got to bring in the family and the network, not just the professional services. So like everybody, I think, Jess, we could talk all day on this. I'm really keen to hear from Jackie, so I'll hand over to you.
Thanks so much, Caitlin, and we may have time for some further discussion afterwards. But if I could now please invite Jackie. Are you there, Jackie, for your reflections on the research and implications for practice, particularly for Aboriginal and Torres Strait Islander families?
Absolutely. Thank you. So firstly, I think it's great to get this baseline data for New South Wales, so that you do sort of, like everyone was saying, you have got somewhere to work from, know what to look for and stuff like that. Firstly, I'm not too surprised about the results for New South Wales, because I think it actually reflects what is happening across the wider Australian community. So we look at the findings and it's a common theme, you know, that echoes through the sort of Asia Pacific regions, and there may also be small unique challenges in sort of various regions in our sector. So we have to work, you know, I've worked on complex cases in child safety and stuff like that. So with the toxic trio, we refer to them as the sort of factors. So that's the domestic and family violence, the drug and alcohol use, and the mental health issues. So we need to get more better about, you know, how we work with families that have those whole three. We need to sort of document and assess, be careful about how we do up our case plans and stuff like that, you know, and make it without judgment, have them strength-based. We need to hold the user of violence sort of to account and have plans which are effective and efficient, and not just ones that we think and are imposed on families. You know, through the use of our core training, issues like sort of the intersections of mental health, drug and alcohol use and stuff like that with domestic and family violence is something that's sort of in our training that we address. Also, that then becomes threefold when families are from sort of Aboriginal Torres Strait Islander backgrounds, people from COLD communities, people from LGBTQI and disabilities. So it's not just sort of one sort of size fits all with our domestic and family violence. I think, Caitlin, you were spot on in regards to, you know, targeting you know, services and having that, seeing what the impact on the children are. And we quite forget that sometimes the families that come to us may come through one door, and then they are involved with other statutory sort of, or authorities, and they're sort of working out, what can I tell you safely that won't have my children removed? What can I tell you? What can I tell you? So we all kind of have our expectations on these families, which is no good for our children and families. I think the implications. I think your recommendations, when I read the report, I went straight to your recommendations, Betty. I think having the integrated service response is very essential, and it can address the sort of the toxic trio or the trifecta issues, and not just one issue at a time. Obviously, I loved your fifth recommendation, saying that specialists being trained with Safe and Together across the sectors, and that will reduce the sort of siloing. We're all going to have a common understanding and language around domestic and family violence. We know that violence, domestic and family violence, doesn't just say, hey, it's physical, it's also mental, emotional, and stuff like that. So I think that everyone should be trained in sort of common language, but having practitioners also from alcohol and drugs, maybe mental health space, to understand how sort of it intersects with domestic violence in the home. So understanding how maybe a user of violence sort of is not taking their meds, and that's a choice. Okay, they know that if they don't take their meds, that it's going to lead to them making bad choices, bad sort of parenting choices, where they may become more controlling or get physical with the survivor or children. So we need to stop sort of working in silos. We may all hold, when we work in silos, the danger is that we all hold certain amounts of information. And so we only see a small amount of sort of the puzzle without seeing the big picture and the realities of our families. But my thoughts, of course, is that recommendations, with Aboriginal and Torres Strait Islander families, yes, it's important to have to think and work with our families. We need to feel safe when we're working with practitioners, no matter where we're working in. We need, to work in our communities. I think one thing is that you Betty, said about partnering with the communities. Absolutely. And be aware that English may not be our first language. Okay, getting some trust also from who is safe in the community and who you can communicate. Preparing before you go out to work with Aboriginal Torres Strait Islander families. Consult with sort of your cultural advisor or someone in the community who can advise how best to approach the family. Okay, check in to see what the cultural protocols are, especially in remote and rural communities. Because I'm Aboriginal, don't assume that I can just go into any Aboriginal family community and be accepted. I too have to watch and know my privilege and stuff like that. Also, don't take reams of paper out when you're visiting, be led by the family. Find out who in the community can hold the user of violence accountable for their choice to be violent. And use terms, their terms. Aboriginal Torres Strait Islander people might say they call it humbugging or no good or it's jealousy. Ask them what that term means. We may have a different implementation, a different idea of what jealousy is, of what humbugging is, of what, no good means. So learn to be comfortable with the silence. Sometimes our people need to think about what you've just said. We need to interpret it. You may have to come back or ring me up the next day to get an answer. I'm not trying to avoid you or sort of be ignorant or, and always check in. Is that your understanding? Because especially when we're doing safety plans and stuff like that, check in to see what you have said. Do they understand it? We may be thinking a whole bunch of other stuff. We may be thinking about, what can I tell you that is safe? What can I tell you that, won't get my kids removed? What can I tell you, that will get you off my doorstep? So I don't want to, I'm going to be thinking about how not to get my children removed from me. So it takes time to build rapport. I know I've got 1 minute to go. Shall I shut up? I've got other stuff, but yeah.
That's okay.
Yeah, and don't
Okay.
be scared to acknowledge the past colonial sort of injustices either. Move on, apologize and move on. Say stuff like, I know I'm the last person you want to see on your front door. I'm here about, his behaviors and see how we can help, so I better stop, otherwise I'll go on forever.
Thanks so much, Jackie. All really insightful and important advice. Look, in the last minute, there are some questions in the chat. Most of them relate to what data is in the Human Services Dataset. So I might let the team answer those in the chat, or Betty, if you're able to answer those in relation to your research. But just in the last minute, perhaps one reflection from each of you, perhaps starting with you, Jackie, and we'll work backwards around, what's your key message, or if there was one policy or practice challenge that you wish you could solve, what would it be?
Is Jackie on mute?
Jackie, you might be on mute.
Whoops, I was going fast too.
Oh, so no, you missed it.
Obviously, to me, I was wondering why you weren't laughing. So obviously, to me, it's sort of get the Safe and Together training and read the report. But the main thing is to be curious, okay? And not nosy curious, but about being deep listening, okay, to what is being said, also what is not to being said. If someone is doing something that does not make sense, ask, why are you doing X, Y, Z? So that's what I want you to be curious about, is doing, she is doing something in the context of how the user of violence is controlling or harming her and the children. Plus, read David's book. But that's it.
Fantastic. Thank you, Jackie. Brianna? Oh, sorry, Caitlin. Sorry, Caitlin.
Oh, sorry. I got booted out, but I'm back in. I'm assuming any last reflections.
That's right.
These are, I wouldn't say complex families, because families are just families, but these are complex issues. And so my last sort of reflection to caseworkers and managers that might be joining us today is use the things in the system to help your practice. Use group supervision, use safeguarding decision-making panels, use the practice kits online, use consultation. Don't sit with these worries about families and children on your own. There's plenty of people in the system that can support our thinking, our critical reflection, and our ideas about how we work with families to address the challenges and reduce the risk, increase the safety and protectiveness. Thanks, Jess.
Thank you so much, Caitlin. Brianna?
Similar vein, I think, recognising that these issues, but domestic and family violence, highly gendered. Let's not have our response perpetuate that gendered nature of that. We don't want to punish women for being victims. It's really problematic. So I think the way through this is everyone at every level, and particularly those working with families, really checking those assumptions and working with women and children to give them voice and agency over processes and decisions, and to make sure there's really clear procedural fairness around the statutory decisions DCJ does have to take, and that we're here to support and there's transparency around all of that.
Thank you. Philippa?
I'm a bit of a systems nerd, so I'm going to slightly different, but systems can be so incredibly powerful. We invest enormous amounts of money in them, and I feel like this kind of research gives us the capacity to more deeply see what they're doing to people and for people. I feel like, particularly like this week, there's a huge amount of focus again on DFE, and the tendency, I think, is to think, oh, it's not working, let's do something new. I think this kind of research gives us absolutely the tools to really investigate these very powerful and entrenched systems that are in place, and that is a really important way forward in terms of making them work better for people and not against people. So yeah, that's what I take from this today.
Thank you so much. And Betty, any final reflections from you?
Thanks so much. Just thank you so much to the panelists. You can see here, this is a initial study using this New South Wales Human Services Dataset that it's brought up a lot of insights, a lot of thoughts, and further areas of exploration. So we're really just at the beginning. So, thank you so much for the ideas, and like really noting the point that, every line that I've seen, that I've analyzed, is a story of a child and family, right? And we can supplement that with the stories of, those children and families too, to really get a sense of what's the experiences are, and then really narrowing in on how we can address and better support children and families. So thank you so much.
Thank you so much, Betty. Thank you all so much for joining us today. Apologies for going a few minutes over, but it's been a really, really interesting discussion. So we will send out the links to these presentations and also related documents. And we also invite you to our next Lunch and Learn research seminar on the 28th of May. So thank you so much and have a great day.